containing COVID. Let's go to the phones. We'll stick with the mayors, and we'll get Mayor Paul McDonald on to the show. Good morning, Mayor.
Good morning, Chris.
Hey, just wanted to bring you on here. First of all, before we get into this choice bill, I saw that you guys are doing something cool in Agania Heights for the graduates. You want to talk a little bit about that? There's a wall that you're putting up banners to honor the graduates from Agania Heights, right?
Yes, and we actually feel bad because of the situation, and the graduates, wherever you're graduating from, deserve recognition, for their accomplishment, and this is the least we could do for them. And the response was overwhelming. We thought we were just going to have a few, but now when we started to put up the pictures, we're receiving a lot of phone calls from other graduates, and that's the whole idea, is to recognize these youngsters that you've accomplished something that we actually wish that everybody would do, no?
Right. Yeah. And it was really cool. We'll promo it this week, Mayor. I got the pictures from the staff, but I wanted to get you on here because you were one of the first voices really to raise concerns about this sole source health insurance contract. So we know you definitely had your issues with Aetna, right? And this stemmed from the way you were treated when you went off island for medical care.
Yes, Chris, and I actually feel for the other patients too that were there when I was being seen in St. Luke's. As a matter of fact, several of them, I don't know how they actually survived out there when we had so many unknowns and surprises of what's covered and what's not covered. They should make it clear even before a patient leaves here, and that it's not a sure thing that you're going to be helped with the bills, and everybody gets insurance because of the purpose of helping us pay up, especially for we can't afford the bills from the hospital. It's just terrible.
The mayor has kind of snuck up on me, I think because of the COVID, but they're actually hearing this bill in the session this week. So have you been in contact with any of your friends down in the Guam legislature, and what's their take on this?
Yes, Chris, it's the legislature. Are you there to help the people or help the government? That's the question that they should ask themselves. And if it's going to cost us a couple dollars more, then please, let's lessen the burden for the patients that don't have money, and make it convenient for them. Mm-hmm. First of all, especially when you're referred off island, right? You don't have the resources to go back, and a lot of people would have no resource to go back and borrow money while you're there, being treated for whatever ailment you have. And then, that's what I've actually spoke to a lot of the senators about. And apparently we the mayor's council, I introduced a resolution, and apparently everybody in the mayor's council agree.
Right.
And I hope that the legislature will be considerate about our people being treated, especially off island.
Right, and I think there's two prongs to this. There's the way people are bitter about how they were treated, especially a lot of the retirees. Man, it hurts, and it's so heartbreaking because our Monomco not the healthiest generation, and that's so right. they do a lot of they use the insurance a lot. They go off island a lot. I've just heard so many sob stories about it. And then the flip side is that people just want to have a choice. You know what I mean?
Of course.
Right. And so I think it's interesting that so much time has passed since this was first discussed that I'm not sure if the senators have forgotten the support that this measure has and the urgency that was communicated with the resolution from the Mayor's Council of Guam. I know that there was petitions going around, signed by thousands of people. So people obviously have their opinion about this, especially when you ask the GovGuam employees and the retirees. But now it's kind of shifted to this conversation about the cost of it. And I was just thinking last night when I was doing my beach walk, like healthcare, that's one thing you don't want the Western family version of. I think when it comes to especially our retirees who work so hard for this island, for this government, for the people, why are we going to skimp on them,
That's right. And again, it's just overwhelming when we were there. Oh my God! There were several people that were there that had to come home because they couldn't get any answers, or they couldn't get treated because they cannot afford it. It's very sad, and like I said, that we should have the choice. We should have the choice. And competition, right, is good too.
Yeah, I mean, it's good for everything except for apparently the health insurance now.
Right.
I was watching the session last night, and I kind of, it was Senator Piro Terlahi was asked a question by Senator Regine, and it was, there was something in the bill that she'd asked him about, and he just kind of went off in Chamorro saying, basically what you're saying, like, hey, are we here to help the people or not? You know what I mean? That's what we're elected to do?
Exactly.
If we're not here to help the people, then why are we even here?
Exactly. And it's when I said in the beginning, it's either you want the government or you're helping the people. And Chris, I don't believe in government making money. It's helping people.
Right.
And by golly, if we didn't have this situation now with this COVID thing, the Corona thing, I'm pretty sure that you're going to hear a lot more from people that are being treated off-sided.
Right, and I think that's why, I mean, I understand the timing of it, and they're getting it in before the negotiating team meets, but I think it's key that people know that this is being discussed, because I don't think they do.
That's right.
And so, call your senators, especially the retirees. I was on the phone with Mr. Leon Guerrero from the Retirement Fund this morning, and he didn't even know they were hearing the bill. I said, yeah, Mr. LG, you better check your your people, where they stand on this, because I'm hearing a lot of grumbling from the retirees.
Yes, and Chris, I've met a lot of people that are saying they're not going to enroll on insurance. I go, guys, that's dangerous, You can, everybody's prone to accidents, and if you get into an accident or what, but that's exactly why we're buying insurance, that we get insured, so that we can afford to live on, and get treated.
Just in case, Mayor.
Yeah.
Well, we know you're going to discuss it in the meeting tomorrow. What kind of discussion are you guys are you looking forward to, Mayor?
Oh, I don't know if anybody brings it up. What can we do? The legislature, a lot of them don't listen to us. We have a resolution already, and they should look at it and reconsider the no choice, and give us the choice.
Right on. And Mayor, I think you got to do your part too, and run this up the flagpole, let people know that this is what's being discussed this week, because I usually pay attention, but it's snuck by me. So.
Yeah. No, I'm gonna suggest to my colleagues that they contact all these their constituents to call your senator and tell them, we need insurance, and we need affordable insurance, and we need to know, and not to go off island and you don't know what you're going to run into.
Right. Yeah. Well, thank you, Mayor.
You're welcome.
Then we'll catch up with you after the meeting, okay?
Yes, sir.
All right, you go tell Tanana and Tun Pete.
Hasta. Adios.
Okay.
Okay.
So wash your hands. Oh, hey.